Welcome back to this episode of Tiger Talk. I'm your host, Mika, and for today I have a very special guest and SMSA alumni, Matthew Beauregard, here to talk about his career path after graduating high school. During his time here at SMSA, Matthew was a 3-year starting offensive lineman for the football team. Following him graduating with the rest of the 2012 class, he decided to continue his education in both West Hartford and Storrs branches for the University of Connecticut. After graduating in May of 2016 with his bachelor's degree in Allied Health and Sciences, he began working at Hartford Hospital's Bone and Joint Institute as a patient care associate, or nurse's aide, to obtain clinical hours for applying to PA school. In December of 2020, he graduated with his master's degree in physician's assistant studies from Lipkin University in Nashville, Tennessee. Senior Abby Bellows met with Matthew on a Google Meet earlier this morning to learn more.
Hi, Matt. How are you doing today?
Good morning. How are you?
I'm good, thank you. So, congratulations on becoming a physician's assistant.
Thank you.
It must have been a long process. We're so happy to be talking to a new old SMSA student. So what made you want to attend SMSA initially?
Yeah, so I knew from a young age that I wanted to do medicine, and I felt like SMSA had the pathway for me to get into the medical field the best way. I attended classical magnet school in Hartford for middle school, and I just knew that wasn't really the way that they structured the curriculum wasn't really around where I wanted to go, and it had nothing to do with the school. It was a great school, but I just knew SMSA was where I wanted to be. And when I was accepted, I remember it was like so exciting. It was like my mom was out of town. My dad had opened the mail and he was like, "Matt, check this out." And he like handed me the mail. And I remember, this is no lie, I ran outside and I think I ran around the block like one time out of excitement, you know? But yeah, I just knew SMSA was kind of where I wanted to go. I loved sports and I loved medicine. So I thought it combined really well. And once I got there, I solidified it.
Yeah, I think a lot of students feel the same way when they got accepted, especially because it's a great place for if you want to go into a medical career. So do you think SMSA had a big impact on your career choice?
For sure, for sure. As I was going through school, I think I changed what I wanted to do probably about 5 times. And even when I left, I still didn't want to do what I did now. When I got to college is when I really solidified more of like the physician assistant role. But when I was in SMSA, I went from wanting to be a doctor to wanting to be a medical researcher, and then I wanted to do something in like the lab. And so by the end of time, I knew I wanted to go into medicine. I knew I wanted to do something with medicine.
Right.
So I definitely felt like SMSA was what kind of shaped me around that and kind of where I wanted to go. But once I got to college, I kind of solidified it a little bit more to doing the PA role. Once I learned a little bit more about it too.
Right.
Mm-hmm.
So with the influence that the school gave you, was there any like teachers in specific that kind of like inspired you or like kind of influenced where you wanted to go into?
Honestly, there was so many great teachers at SMSA. I don't know if I can specify one specific teacher. There was a lot of great science teachers. There was a lot of just great overall teachers. Miss Zamorsky was a great teacher. I had her class for UConn English. But other teachers that I know aren't there anymore. Dr. Beebe was a great teacher that kind of solidified more on the science end. Mr. Savoda, so there was a lot of great science teachers on that side of things that did a little bit more medicine-based stuff that I think also pointed me in the direction of where I wanted to go with that.
Right.
Mm-hmm.
So obviously the teachers and the education is a great part of SMSA, but like, what do you think was the best part of attending SMSA?
Honestly, I think it was the family aspect of things, especially because I made such great relationships with everyone at SMSA. And even when I graduated, I remember feeling so sad about leaving. So, yeah, that's what I thought was best part.
That's what made me want to go to SMSA when I shadowed. I saw the whole family aspect and I was like, this is where I want to go.
For sure.
Since you had that whole family aspect, would you like to share some of your favorite memories from SMSA?
Yeah, so I played on the football team, and we had some great memories in the sense of just the team playing together. Also, I would just say the laughs and just Memories shared. I remember this is actually funny. Mr. Mraz, during my junior year, it was the UConn semifinal of the Big East Championship. This is the year they won 11 games in like I don't know, like 30 days or something, but it was like 11 straight games. And I remember he was like, "Hey guys, we need to stop class for a minute, go downstairs." And we're all like, "What's going on?" And he's like, "Hey, we need to go down to the workout room." So we turned on the TV and literally watched the ending of the game, which is known notoriously as the UConn Pittsburgh game when Kemba Walker hits the step back shot to win it. And I remember we all went crazy. It was like the coolest moment. But overall, though, I just think there were so many great memories. I don't know if I can like specifically pick one, but honestly, I had a great experience at SMSA. I loved the school. I love the faculty. I love the students. I still keep in contact with a lot of students. Well, yeah.
So you brought up playing on the football team. What was that like?
It was great. I played under two different coaches. I played under Coach Green my first 2 years, and then I played under Coach Martin my last 2 years. Very, very like family based. I got close with a lot of the guys on the team, and once again, still stay in contact with a lot of them. I really enjoyed my time on the football team. I felt like it helped me grow in many ways. At first, when I first started, I didn't want to do it. I started wanting to do it, and I was like, I don't know if this is for me. And I just stuck with it. And once I got kind of into it and then like found out more about the sport, because when I first started my freshman year, I hadn't ever played football before. So once I got to kind of understand the sport a little bit more and kind of how it worked, I grew to really love it. And unfortunately, during my senior year, I hurt my back during like practice 2 days before our first game. And I ended up playing like 8 games of the 10 games that season after my back kind of healed up enough for me to play. But I decided it'd be best for me at that point to stop playing football and just focus on academics.
Yeah, I mean, it's a respectable decision. So is that what made you want to attend UConn, the academic piece
For
instead
sure.
of the sports piece?
Mm-hmm. I knew UConn was a great place for me. I knew they had a strong medical background to their school, and they had a pretty good science program that would get me to where I wanted to go, regardless of where I headed in my career at that time when I entered UConn. So when I went to UConn, I actually started at the branch campus in West Hartford, which was easier for me because I wanted to commute, and I felt like commuting was best for me to save money. So I started my first 2 years there, and then I went up to Stores and did more of my major classes, like anatomy and physiology. And then after my sophomore year, I also got accepted into the allied health program at UConn, which is you have to be accepted into it, and it's a long process. But they had all my classes up in Stores, so that's what I did my last 2 years, and I ended up graduating with a bachelor's in allied health sciences with a minor in biology. So,
Oh, congratulations.
thank you.
Was the transition from high school into college difficult? I know a lot of students are interested, especially our seniors, on how that's going to be.
I think it's a smooth transition. I think you get a good base in high school, and then when you get to college, it's like another step up. But it's more independence, right? It's more about, hey, you have to keep yourself accountable to getting things done. Whereas with high school, it's kind of like you have this due, and you get it. And I'm not saying that's not same thing with college, but you have a lot more tests in college. You just have to keep yourself accountable on when to study and how to study, and it kind of is like a full process. So.
Right. Yeah. I understand that completely. So you went to UConn initially to go into major?
Say that again.
To go into what was your major when you started at UConn?
I went in as an exploratory major or ACES major, which is like at the time it's like you don't know what you want to do, but I knew what I wanted to do, which was great because as I was going through, I shaped my classes around medicine. It was just when I got accepted, that was the major I got accepted under, which was great because, like I said, from there you could go anywhere. So if for some reason, like my sophomore year, I decided I didn't want to do medicine, I could go somewhere else. And that's just speaking in general for anybody who applies to UConn. The ACES major or exploratory major is a great way to go because you can kind of branch off from there. And within the ACES or exploratory major, you're able to shape around what you want to do even if you know what you want to do, but you're not like a part of that specific major yet.
Right. So you started off as an ACEs. So then what made you want to become a PA?
Yeah, so as I went through school, I just discovered more about the PA role. I had talked to a family member of mine who was a nurse practitioner, and this was early in my schooling. I would say this was like probably my freshman year. She's like, "Hey, you should look into PA." So I started looking into it. And like I said, at this point, I knew I wanted to go into medicine, but I didn't know where I wanted to go. So I was just looking around, researching a little bit about different fields. And as I was going through school, I actually came in contact with a PA in the emergency room when I was doing some EMT training, because at this point I knew I needed to get clinical hours to go wherever I wanted to go. So I had met a PA and I asked her, "Hey, can I shadow with you on a procedure?" And we got the consent from the patient. And I ended up spending like a few hours with her, and I talked to her and she gave me her contact information and we stayed in contact. And honestly, just more research and that experience and just a plethora of different things got my interest into, okay, this is something I really think I would love to do. So I ended up, like I said, I ended up just doing more research. And by the time I was done with school, I knew that that's what I wanted to do. So I carried out my clinical hours and then I applied to PA school and luckily got in on my first try.
Oh, wow. Congratulations.
Thank you. Thank you.
So obviously being a PA is a medical career and medical school is not easy. So what did it take to become a PA? Like, what was PA school like?
Yeah, so it's tough. PA school, it depends on kind of where you go. It can be anywhere from 24 to 30 months in duration. We train under the medical model, which is similar to what a physician is trained under. And pretty much it's tough. You know, you get trained a lot of what a doctor knows in that short period of time. So it's for my program, it was a 27-month program. We did 15 months of didactic, which is in classroom learning, pathophysiology, clinical medicine, pharmacology, laboratory based medicine. These are just a few examples of the classes I took, but it's very rigorous and intense. But Oh, I'm sorry. Let me finish up the other part. And then there was 12 months of clinical, which is where you're in the hospital. And we did 8 different rotations. I'm going to try to remember off the top, just in the order that I did them. So we have a rotation in family med, internal med, women's health, pediatrics, and then you have an elective rotation that you can do. Emergency room, mental health, and then surgery. Those are your 8 rotations for my program. And that was done within 12 months. So we started in January of 2020 and ended in the end of December of 2020. And that's when we graduated. But what I was going to say was what's great with the PA role or just PA profession in general is that you have a lot of you're very versatile. You can switch fields as you need. We're trained in all fields of medicine. So if out of school, somebody wants to start in cardiology, but then like 2 years down the road, they say, hey, I want to go into GI. They can switch with no extra training. And it's a smooth transition from one job to the next. So, which is a great thing about PA. And one more thing, sorry, I know I keep talking here a little bit, but I just want to make sure. We also work in like a collaborative role with a physician. So we always have a physician that we can turn to if we have questions. PAs function in, like I said, many different settings. They can function in the ER setting where it's more intense, a trauma setting, or they can even, and that's in hospital, that's more hospital based. And then they can do also like outpatient, like family medicine type practice where they're more of a patient's primary care provider.
So you yourself, you got out of PA school, went to Connecticut Children's, right? What made you want to do that?
Well, out of PA school, I'm sorry, before PA school, I was working at Bone and Joint Institute to get my clinical hours. Since being out of PA school, I've still just been applying. I haven't actually gotten a job yet. It's been a struggle. The market is still kind of tough right now. but just keep applying. I'm kind of in that application interview process right now. And unfortunately, I haven't really gotten any interviews yet. Once again, just being a new grad, it's kind of tough with the market being bad because of COVID and being a new grad. They like people with experience that I don't really have other than my clinical experience during PA school. So right now I'm kind of in that limbo process, but hopefully soon. We'll hopefully get something soon. So.
And it's definitely difficult with the pandemic going on too to get anywhere in the medical field.
For
So,
sure.
where do you see yourself in the next 5 to 10 years now that you're out of PA school and looking for a career?
Yeah, that's a good question. I'm obviously working as a PA somewhere. I've kind of more centered around the Southeast, more like North Carolina, South Carolina, Georgia, Florida, but I'd be willing to go anywhere. Or I think I could see myself really anywhere, practicing, treating patients, and just making a difference in their lives. I think that's the biggest thing for me. Why I went into PA was just the opportunity to be able to touch lives and to be able to make an impact in whatever way I could. So that's where I see myself in the next 5 to 10 years. Yeah.
Do you see yourself in more of like a hospital setting or like a pediatric setting? Because you had mentioned earlier that with the PA, you can pretty much work anywhere.
Yeah, that's a good question too. I'm not quite sure yet. At first, when I first started PA school and I started my rotations, I really liked the outpatient setting, which I still do. But then I got a little taste of the inpatient setting, which is also what I did. When I worked at the Hartford Hospital at the Bone and Joint Institute as a PCA. So I knew a little bit about the inpatient setting. But once I got in as like a practicing PA, like during my time in clinicals, I got to kind of see a little bit more of the role in the inpatient setting, and I really like that too. So right now, I'm not quite sure. I've been applying more for inpatient settings, but I could see myself in either or.
Great.
Mhm.
So obviously you've come a long way since your freshman year at SMSA to graduating PA school. So obviously that's a long, hard process, a lot of hard work and difficulties throughout that time. So what piece of advice would you give to SMSA students that are pursuing a medical career?
Yeah, just I think one of the biggest things is sometimes it can get kind of frustrating. If you have struggles or if things are hard, I would just say stay persistent. If it's something you really want to do, just stay persistent, keep working hard. Know that at the end of the day, it's gonna pay off. There's no doubt about it. That's kind of the biggest advice I can give. I can tell you right now that it's the best thing I ever did was to become a PA. Just in the time I've had to go through school and have clinicals and be able to have those interactions during clinicals and see the effects that I've made on patients just during those 12 months. It's definitely rewarding, and I already feel like it's paid off. So.
Again, congratulations on graduating PA school.
You.
All the questions we have for today. So thank you so much for joining us.
Thank you.
Pleasure meeting you.
Thank you.
Thank you, Matthew, for taking the time out of your busy schedule and sharing your experience with us. Hopefully it is helpful for some students who might be going through the same scenario. The way you never give up, even when things aren't on your side, shows your dedication. Surely some students will get motivated and not to give up on their dreams and be inspired by listening to your story. Thank you for listening to Matthew's wonderful story. We look forward to seeing you next time. Stay safe, SMSA.